Hello, my name is Ashley Ventura, and I will be talking today about maternal mortality rates. The World Health Organization defines it as the death of a woman while pregnant or within 42 days of termination of pregnancy, irrespective of the duration and the site of the pregnancy, from any causes related to or aggravated by the pregnancy or its management, but not from accidental or incidental causes. Maternal mortality rate is something that affects not only the mothers who give birth, this affects family members and close friends of the mother. The target audience of this presentation is women of color and their support systems, as we see that they are affected at disgustingly higher rates than the rest of the races. The significance of this is because women's health is at jeopardy and the entire community could be at stake if these continue to rise. Um, the national average for maternal mortality rate is 22.3%. On the other hand, for the rate for Black African American women in the United States is 69%, which is disproportionately higher than others. A timeline for when postpartum or maternal mortality could hit is two-thirds of the deaths occur in postpartum period. 12% of the first within the first week, 23% between the first and sixth week, and 30% between the seventh week and a year. So this is an elongated timeline of when we need to be watching and being extra cautious of women after they give birth or before they give birth or while they're pregnant. Some doctors even would push the timeline back up to 7 years because many women have heart problems that take time to heal and for their body to get back to their regular functioning homeostasis. Some challenges that occur and that women have um, dealing with and trying to get help with postpartum care or prenatal care is very hard to get in America because everything is expensive, and America is the only one without a federally mandated maternal leave or maternal insurance. But the leading causes of maternal and of maternal deaths of minority women and non-Hispanic Black women are eclampsia, preeclampsia, postpartum cardiomyopathy, which is all 5 times higher than the non-Hispanic white women rates. The United States is the only country without universal insurance coverage of maternity or postpartum care, meaning that millions of women around the country do not have guaranteed care when they get pregnant or after they give birth. Many socioeconomic factors contribute to the factors leading um, to the cardiovascular disease, which then in turn leads to the postpartum deaths. And this could be from stress factors limited to the limited access of goods, of good prenatal and postpartum care, limited access to healthy foods, the challenges these women face during pregnancy um, are leading them to have higher rates of cardiovascular and preeclampsia during and after pregnancy. Here is the CDC's way or idea, a couple of ideas to help reduce maternal mortality rates, and that is, um, I'm going to give you a couple of facts, and that's that the 22.3% national average per 1,000 live births. And that is, women in the United States are more likely to die from childbirth or problems related to pregnancy than women in other higher income countries. In addition, there's a persistent disparity by race and ethnicity. There are great disparities between racial and ethnic groups. Black and African American women experience twice as high maternal maternal mortality rate than other mothers. They experience it at 69% per the 100,000 births. And then one below that is Latino and Hispanic women at 28%. Uh, and some ways we have been trying to advocate for people to do is, education. Educating people is the best way to reduce the maternal mortality rate, allowing for resources to be flexible enough for those who don't have the leisure time to go to doctor's appointments and stuff like that. But also allowing and giving the same access to those who are underinsured. And one of the ways we can do that is we need to humanize care. It needs to be people focused instead of disease focused. And that way we can understand and listen to the people that are asking for our help. This is the statistics media graphics. It is just a visual of showing it's not updated, but this is the visual showing of just what the numbers actually look like. This is the devastating disparity between the deaths of black women. As you can see that mothers are dying at way higher rates than white mothers or even Hispanic mothers at that. And these are some things that we need to take account in and take responsibility for. This is a graphic showing the risk factors and the different biases and stuff that increase the maternal mortality rate. But these are some ways, and recognizing that these are potential risk preventions in reducing maternal mortality rate. We could, by increasing and adjusting the access to care, especially women who are in healthcare deserts. Cardiovascular conditions. As soon as someone gets pregnant, we could be more on top of and more on their health. Hemorrhage also is, we need to be able to keep their health regulated, as well as hypertensive disorders, implicit bias within the healthcare organizations, and maternal mental health is something that people drastically need help with. A couple prevention tips could be helpful in recognizing the errors in the system and possibly reducing the maternal mortality rates. And this is, we can achieve this by modernizing public healthcare infrastructure, by allowing um, it to be a patient first and a patient inclusive system, as well as recognizing maternal health disparities. And not everybody has the same access to all of the resources and the needed vitamins and the needed healthy food and the access to OBGYNs. Also, achieving cultural competency and bias reduction. We could do this by allowing, insight to other cultures, improving awareness and pers- compensation counseling, remodeling healthcare delivery rooms, promote payment invention innovation models, and expand on the postpartum care. I feel like things that need to change in order for the system to change is changing clinical education, policy reform, multidisciplinary care, and sex specific scientific research. These are a couple helpful links that help provide education and a couple questions that need to be answered if anybody has questions, or if they want to know how desperate or how big this problem is in the United States. There's a link for that. And there's a link at the bottom to help reduce, if not eliminate, mortality rates by a couple initiatives by the CDC. These are my references, and thank you very much.